Good afternoon, everyone. Today I'll be discussing childhood obesity using the ecological model as a framework. This model allows us to analyze how individual behavior, family dynamics, community settings, organizations, and broader societal factors all play a role in shaping health outcomes. Childhood obesity is not just a personal or family issue. It's a public health crisis with complex causes and long-term consequences. According to the CDC, nearly 1 in 5 children in the United States is affected by population. Genetics may contribute to obesity risk, but behaviors are typically more modifiable, making this a primary target for interventions. Family influences are strong predictors of a child's weight. For instance, children with obese parents are more likely to become obese themselves due to shared genetics and environmental habits. Family routines, such as skipping breakfast or relying on convenience foods, can further increase the risk. Parents' nutritional knowledge and attitudes towards exercise directly impact their children's behavior. Unfortunately, in many households, busy work schedules, financial constraints, and lack of awareness lead to unhealthy routines. Communities shape health by providing, or failing to provide, safe, supportive environments. Children in underserved areas often lack access to playgrounds, parks, and grocery stores that offer fresh produce. These areas, known as food deserts, are often flooded with fast food options, making unhealthy choices easier and cheaper. Additionally, neighborhood safety concerns may prevent children from walking or biking to school, further reducing daily physical activity. Schools and other organizations play a pivotal role. Many schools have reduced recess and physical education time due to academic pressures, despite clear evidence that regular activity improves both health and academic performance. School lunches are also a concern. Meals are often high in sodium, sugar, and unhealthy fats. On the flip side, schools can be effective change agents by implementing structured health education, nutrition programs, and safe physical activities. At the policy level, issues like zoning laws, transportation, infrastructure, and food marketing regulations come into play. Car-centric city planning discourages walking and biking, while policies that allow fast food advertising targeting at children contribute to poor dietary habits. Socioeconomic disparities further complicate the issue, as low-income families face systemic barriers to healthy living, such as higher food prices and limited access to healthcare. Solving the obesity crisis requires a multidisciplinary effort. Urban planners, educators, healthcare providers, and policymakers must work together, creating walkable cities, improving school meal standards, supporting family health education, and regulating unhealthy food marketing are all important strategies. Collaboration across these sectors ensures that interventions reach children and families at all levels of influence. Communicating about obesity is not easy. Children and families often face stigma, which discourages them from seeking help. According to Poole and Ware, stigma can lead to stress, emotional eating, and social withdrawal, worsening the problem. Health literacy is another barrier. Families may not understand nutritional labels or health information, particularly if it's not culturally or linguistically appropriate. Effective communication must be clear, compassionate, and tailored to diverse populations. Going forward, we need to prioritize systemic changes. Policies that promote affordable health food, build safer neighborhoods, and fund physical education in schools are essential. Programs should be evidence-based and evaluated regularly for effectiveness. Schools, communities, and governments must continue to innovate and work together to prevent obesity and its lifelong consequences. In conclusion, childhood obesity is influenced by a network of individual, social, and environmental factors. The ecological model offers a roadmap for addressing these interconnected layers. From family habits to public policy, every level matters. Tackling this issue requires comprehensive, coordinated efforts that empower families and create healthier environments for all children. Thank you.